Hello, my name is Craig Knowles. I am the kinship care support worker at Hetties. Hetties is a charity in Nottinghamshire that supports adults, parents, and carers affected by somebody else's drug or alcohol use. And like I say, my role within the team is supporting kinship carers. And the presentation that we're doing today is all around understanding attachment and attachment trauma a little bit better, and hopefully giving you some insight into things that can be done to help heal that trauma. So I'll get straight on with sharing my screen and the PowerPoint. You've got a sneak preview there of what's happening. So forgive me for that. Attachment trauma, an introduction. And this has been put together originally by the solicitors Ridley and Hall. There's a link to their services right there. They specialize in kinship care. I've been doing kinship care for 17 years. We've used them often and we've never had bad outcomes. They're very empathetic. They're incredibly knowledgeable and they will definitely be able to help, advise, support in anything kinship related. We're also using um, resources from the excellent Beacon House. There's a link for them as well. I absolutely encourage you to check out both links if you're a kinship carer, because both are very helpful. So, an introduction. I've already told you who I am, but what I would say is if you're watching this on YouTube, then please pause, get a pen and paper ready, take some notes, think about the children or child that you're caring for on each slide, particularly on the second bit of the wall, and the wall will be understandable as we get through it. So don't worry about what I'm saying there. It will be thought provoking and perhaps quite difficult and emotional. So please look after yourself, take some time out, make yourself a brew, do what you need, to get yourself present, and then press play again and keep working through it. Because I do think it will be helpful for you. So attachment is a term used to describe the dependency relationship that a child develops towards his or her primary caregivers. And why do kinship children need a different kind of parenting? And all children have got physical and emotional needs, and how these needs are fulfilled dictates a child's development. And when I say why do children need different kinship children, it's because they have experienced trauma. So parenting in the normal way might not always work. So we're looking at how to parent from a more therapeutic lens, which was going to help them to heal and help you, hopefully, to not become as frustrated or to understand things and look at it from a different lens that makes things feel a little bit more doable, bearable, I guess. It's certainly something that we work with our clients with, and I've got to say, generally it does work. So from 0 to 6 months, a child needs love, stimulation, eye contact, cuddles, security, milk, belonging, warmth, comfort, and attunement. And attunement is almost like the language that you learn as a parent because you notice those subtle cues that a child gives, the body language. You know what your child needs and wants just by their actions. And it might be something as simple as that, or making a noise, and you know exactly what that noise means. So, and that's why, it says there, I need, they start from birth, our needs, and we look to our parents to fulfill them. So from 6 months to 2 years, we're developing speech. We're getting a stronger sense of what family is. We need security. We need belonging. We need love, safety, supervision, understanding, friends, and boundaries. Then from 2 to 5 years, we need interaction, friends, love, trust, boundaries, social skills, security, encouragement, language, and play. Then from 5 to 9, we're developing our roles, learning, choices, opportunities, tasks, friendships, support, love, independence, and also self-reliance. So there's the very healthy wall from all those milestones from 0 to 9 years. All kinship children have experienced some level of trauma. This may have been caused by abuse or neglect in their early lives. They will have been separated from their birth parents. They may have spent time in the care system, sometimes with more than one carer, and they might have also had more than one kinship carer. And all of this will have had an effect on their development and their ability to attach to their new parents. So let's have a look at their wall. A neglected child would rarely or never been cuddled. Their milk might have been infrequent or inconsistent. And remember what I said at the start, just think about your child or children, where they were at these developmental milestones. Have a think about what their world would have looked like between 0 and 6 months. 6 months, where was they? Who was looking after them? And take notes, like I said, press pause if you need to. They might have received little or no parental stimulation. The parents would not have attuned with them because that's impossible, right? If they're not there, if they're not present. Because of this, they might struggle to make friends. Their play may have been unsupervised. They struggle to feel part of a family unit. An abused child might play in an unhealthy way. They may not receive much encouragement or even believe the encouragement that they do get. Forgive me, it's double clicked. They may struggle to trust others. They might experience none or few boundaries on their behavior. All this can cause problems at school. They might fear being left alone. And even though the birth family might love them dearly, so the birth parents, the expression of that love might have been infrequent or even unhealthy. So now let's have a look at the effect of that trauma. Again, think about your own child or children and look at this mess that follows next. So attachment disorder. You can break it down into 4 different aspects: relationships, learning difficulties, obsessions, and behaviors. So with relationships, they might have difficulties maintaining their friendships with peers. They might be clingy or aggressive. We know lots of children within our service that have friendships, but they break down quite quickly. They might be hostile towards their parents. They might resist affection. They have possibly experienced abuse and neglect, and they might be affectionate and overly affectionate with strangers. So then we'll look at the learning difficulties, and those learning difficulties are often presented in learning delays, immature speech, problems with basic literacy and maths. So it's really important for schools and carers to not think about their chronological age, but think of their brain age. Then we'll move on to obsessions. They might have issues with food. It's certainly something, again, that we come across a lot in terms of hiding food, gorging, hoarding. And then there's those fascinations with violence and death, which is, it could be fire, weapons, blood, and gore. And the biggest impact is on behaviors: a lack of conscience, no remorse for actions, retained eye contact while people perceive them to be lying. It might not be that they actually are aware that their version of the truth is different to what other people see. They might have destructive behaviors, and that could be towards themselves, the property, or others. They could be very impulsive and steal. They might not consider the consequences of actions, and they might question everything. And without getting too deep, we could have a session all around every single one of those nodes right there. But for now, it's just about naming them. Now, the effect of trauma and how we can help, like I said at the beginning, there's this really wonderful animation that uh, Beacon House has developed. So I'm going to stop sharing this screen, and then I'm going to hopefully share the animation. Then I will shut up and let you listen to this amazing wee video.
Adults often tell me I have an attachment disorder, but is this what's really going on in my brain? It is actually only one part of a 7-piece jigsaw puzzle called developmental trauma. If you put this puzzle together, you can understand how my adverse childhood experiences have shaped my emotional world and behavior you see. Once you have taken the time to understand this, you can help me using something called the neurosequential model of therapeutics. It's not as complicated as it sounds. It repairs my brain in a special order, but everyone who's part of my world needs to work together to make sure that I have the best chance to heal. This means home, school, therapy, and even my doctor needs to work together as a team.
Health insurance that lets you sleep easy.
How much is the way you currently speak
Forgive
costing
the
you in your personal life and in your career?
If you get this right, my developmental trauma can be repaired. You have probably heard of attachment styles. Most people working with children and young people have. It's the way children's brains have developed to survive dangerous situations. By behaving in a certain way, we believe that adults around us will keep us alive. But now, Dr. Patricia Christensen has proved that children are even more incredible at surviving than we first thought. She has shown that we don't always stay in one attachment style. We change and organize our behavior to make sure we can survive in the moment we are in. In fact, I am so incredible at changing my behavior to survive my different environments, it can be hard for you to believe what's really going on inside of me. I can be very good at school but break down at home, or unable to cope at school but be great at home. We are starting to realise that not all grown-ups know about the 7-piece jigsaw puzzle called developmental trauma. A child who has had early life traumas will show symptoms. Developmental trauma is a set of profound problems in all areas of my development. It's not just older children who can suffer from developmental trauma. Babies can experience it too, even if they are removed from their mother at birth and placed in a safe new home. Any child who has lived in an environment where their trusted adults have not consistently met their emotional and physical needs, and any child who has suffered separation and loss from their family can suffer developmental trauma. A psychiatrist, Bessel van der Kolk, has taught us that the 7 jigsaw pieces of developmental trauma includes somatic sensory issues in my brainstem, attachment, emotional regulation, and behavioral regulation issues in my limbic brain, self-esteem issues, dissociation, and cognitive problems in my cortical brain. If you want to support me, then you need to consider every single one of these jigsaw pieces. Because I suffered early adverse experiences, my brain is not working the way it should. As my brain grew, the toxic environment I was in,
Health insurance that lets you sleep easy.
stopped it from developing in the way it should, essentially giving me brain damage. But with your help, my brain can be repaired, However, it needs to be done in the right order, using the right tools, with everyone working together as a team for this to happen. A psychiatrist called Bruce Perry has developed a neurosequential model of therapeutics that helps us treat kids' brains in the right order. Because even if you are the best, most amazing therapist in the world, if you start in the wrong time and place, it won't work. Brain develops from the bottom up. First, the brainstem grows. This is where my motor and sensory input is found. Secondly, my limbic brain grows. This is where my attachment, emotions, and behavior are held. Third is my cortical brain. This is where I do my thinking, inhibiting, and learning. The job of my primitive brain, the brainstem, is to keep me safe. It is the part of me that keeps me alive. This was extra important when I was in a dangerous environment. It sent me into fight, flight, or freeze, whatever I needed to survive. The problem is my brain got stuck there, so now I am safe. I can't switch my primitive brain off. I'm always in survival mode. My everyday life still feels dangerous. Because I'm stuck here, not much can get past it up to the other areas of my brain. This means that I find it really hard to form deep relationships, manage my emotions and behavior, think and learn and understand. I am simply trying to stay alive. I am stuck in a survival loop. I am hyper alert to danger. I experience life as normal cues or danger cues. I go into fight, flight, freeze continuously. I cannot take in nurture or information to make sense of cue. So my brain has developed from the bottom up. The higher parts of my brain are not getting the right messages. Importantly, if I'm stuck in the primitive brain, I will not be able to learn, no matter how good my teacher is. A proper assessment can show us whether a child needs support to develop their brainstem, their limbic brain or their cortical brain. Different therapies are good for different parts of the brain. Not all children need to start at the bottom in the brainstem. It is also important to stay flexible when treating developmental trauma. For example, a child could be well regulated and working on attachment in their limbic brain, but then they might have a big change happen in their life. They might move to secondary school or perhaps have a bereavement. This may trigger a brainstem response for a few weeks or months. This means they might need a different focus in therapy to help them get regulated again before they can start thinking and connecting in their limbic brain again. The ideal is that the child and the therapy moves with a little bit of fluidity between the different brain regions, but only does reflective stuff in the limbic and cortical brain if the child is safe and regulated. So what does this knowledge mean? How can the different grown-ups in my life work together to help repair my brain? 1. Everyone needs to understand developmental trauma. 2. Make sure every environment in my life is stable. 3. Make sure your most trusted adult is supported and nurtured. If home is not safe, nothing else will be effective. 4. Look after my trusted adult. Their brain's my safe place. If they are okay, over time it will calm my fear. 5. Start in my brainstem. I cannot process conversations until my primitive brain has been repaired. If you try, I will fail and you could make things worse as my brain is trying to do something it isn't capable of at the moment. 6. Normal parenting doesn't work. My parental care will need to parent me therapeutically and will need support doing this, so they can teach me how to regulate my world and I can learn to feel safe in that relationship. 7. If I'm stuck in my brainstem, the treatment needs to be patterned and repetitive. I need my fear response calmed and to reattune in my important relationship. This sensory works needs to be done first before I can process any side with therapy.
How you sound to you is not how you sound to others. Because when I open my mouth and I speak,
A. Retraining my brainstem will take time. I need consistent, predictable, patterned, and very frequent brainstem activities before you can expect me to think, learn, and reflect. Changing my whole brain will take persistence and time. 9. Each part of my world needs to be working on the same place. Brain repair bottom up. Home, school, and therapy need to understand which part of the brain they are working on and doing it together. 10. Arrange my world according to my brain age, not my birth age. Responding to my developmental age will be more effective in the moment than assuming my chronological age is the way to approach me. 11. I'm unique. A proper trauma-informed psychological assessment will tell you where I'm stuck and the best place to start my treatment. 12. Help me as early as possible. If you can start working on my brainstem, the moment I am safe, it will help my brain repair faster and mean I don't have to grow up experience the pain of my brain injury. 13. Like you, I'm a complex being and I need every part of my world working together to help repair my brain. You must work together for any work that is being done to be effective. If you want me to meet the separate milestones in my different worlds, schools, homes, and therapy, you must all be working using the same approach. 14. Be a safe, healthy, caring, and consistent adult. We are all designed to exist together as close communities. I need you. At Beacon House, I'm supported and surrounded by a team of people, all working from the same place. Home, school, therapy, and my wider support network of family and friends. Relationships heal relationship trauma. Now you understand how a scientific approach to healing can make a real difference to me. What can you do differently to help? How can you change my future?
I hope you found that useful, thought-provoking, and informative. If you're a kinship carer watching this, I would advise you to go back and watch that again, and then again. And at point 4, remember what that child said. Look after my carer, because you are important too. And you need to be able to make sure that you still do weave into your own daily routine something that's going to help you to recharge. And I know that's easier said than done, but please do your best to diary it in. And if you're pulled from pillar to post and doing things for everyone else, or you're one of those people that would be described as would do anything for anyone, just remember anyone includes you. So put yourself in your diary, and if somebody else wants a PC1 that time, just say, no, I'm really sorry. I've got a very important meeting that I cannot get out of and that I don't want to get out of. Moreover, because you're important too, and you can't help your child or children back into their own window of tolerance if you're working outside of your own. And if you think, what's he talking about? Window of tolerance, go back onto Beacon House, look at their resources, or simply Google Beacon House Window of Tolerance. There's 2, and I would encourage you to watch them both because they're both very powerful and useful. So I'll get off my little Beacon House soapbox for a minute, and I'll get off my little You Matter Too, and we'll go back to that presentation to do the last few slides, hopefully. So yeah, again, we've just gone through that PowerPoint, sorry, that animation. Dependent on how you're feeling right now, it might be a good place to pause. But we're going to do our best to do, excuse me, the next slide. if it's going to allow me to do it again. Bear with me. Me and technology are not good bedfellows. Yeah, we've done it. Oh, here we go, double click time. So another very useful thing for you to have a look at is parenting with PACE. And PACE stands for playfulness, acceptance, curiosity, and empathy. P, I would also chuck in there playfulness, sorry, patience. We do need to be patient. We do need to trust the process. And the animation that we've just watched, I forgot to mention, if you're having any issues and difficulties at school with them singing off the same therapeutic song sheet, I would encourage you to send that to their main teacher and then have a discussion around it to see what they can do to make the reasonable adjustments that any school or employer should have to make. So PACE is a way of thinking, feeling, communicating, and behaving that aims to make the child feel safe. It's based upon how parents connect, and that's what children are looking for, connection with their very young infants. As with young toddlers, with the safety, the child can begin to explore. With PACE, the troubled child can start to look at himself or herself and let others start to see them and get closer emotionally. She, he can start to trust. Have a look at that link. Professor Dan Hughes, amazing man, that's got such a wealth of information, done lots of books. Google it, have a look. Fill your mind with knowledge. PACE is a way of therapeutically parenting. We also have a PowerPoint on it relating to PACE. And again, if you're in Nottinghamshire and you want to email in, then let me know. But if you're getting support from us, we do cover that in our sessions in more in depth. And again, it references Beacon House there. Please check out their stuff. Again, in Nottinghamshire, for local support, there's the excellent Kinship Support Service. Click on that link or, just Google Kinship Support Service Nottinghamshire. Their information will come up. If you have clicked it, you'll get to that page. Then there's the Contact Us page. They've got a dedicated number and email. If you do ring, it will be an answer phone service, but they will get back to you. If you email, they will get back to you. It's a quality team, got nothing but respect for them. So please reach out to them if you need support in Nottinghamshire. Then there's a few books there for you to have a look at. I'll just go back one. It's double clicked again. It's double clicked again. We'll get there. If you've got any questions, email them to me. And if you're in Nottinghamshire and want some support or further information, email me. If you're not in Nottinghamshire, then have a look at the national charity Kinship. There's our website there and our bit on kinship care as well. So thank you very much for watching this. I do hope that you found it helpful. Please tell me if you think it's rubbish. Please tell me if you think it's okay. I'm happy to have anything that's constructive. So thanks again, and we'll see you on the next video. You take care. Bye-bye.